Walang sukisok ti kasasaad dagiti manalon ti barangay Nambaran, Santo Domingo, Ilocos Sur. Maysa a panangipataros babaen iti interview ken survey.
Our study panang sukisok ti kasasaad dagiti mannalon iti barangay Nambaran, Santo Domingo, Ilocos Sur focuses on assessing the well-being of farmers. Why they play a crucial role in food production, their health and quality of life are often overlooked. Through surveys and interviews, we aim to understand their lifestyle, nutrition, and healthcare access. The insights gathered will help inform local leaders and organizations in developing programs that promote better health, improve living conditions, and stronger community support for farmers. This research is conducted with respect for participants' privacy and convenience, with the goal of contributing to sustainable improvements in their quality of life.
The primary healthcare system in Barangay Nambaran is generally accessible, with healthcare facilities available to most residents. Public transportation is widely present, making it easier to reach medical services. However, the sufficiency of health programs is uncertain, as some residents are unsure of their adequacy. The high cost of healthcare is a major concern, along with a lack of health awareness, which may limit the community's ability to access and utilize available services. While the community maintains good cleanliness standards, limited recreational spaces and gaps in health education may affect overall well-being.
This project assesses the health and lifestyle of farmers in Barangay Nambaran. To contribute to the UN's Sustainable Development Goal 3, Good Health and Well-Being, specifically Target 3.8, Universal Healthcare Access. Findings will help address healthcare gaps in rural communities, supporting the Philippine Universal Healthcare Act and regional initiatives in Ilocos Sur. Focus on nutrition, sanitation, and preventive care. The goal is to improve health outcomes and sustainable community well-being.
The specific objectives of this study is to assess the lifestyle of farmers in Barangay Nambaran, Santo Domingo, Ilocos Sur, focusing on their daily routines, work habits, physical activity, and health behaviors. Number 2 is to evaluate the nutritional status of farmers in the community, including their dietary patterns, food security, and the prevalence of malnutrition or related health issues. And number 3 is to identify and analyze various socioeconomic, environmental, and cultural factors that influence the well-being of farmers in the community, including access to healthcare, education, and economic resources.
To ensure that our study is meaningful and beneficial, we use a community-based and people-centered approach, prioritizing farmers' needs and concerns. Through direct surveys and interviews, we gathered first-hand insights into their lifestyle, nutrition, and healthcare access. Our study is also evidence-based, analyzing collected data to identify health challenges and service gaps. This helps promote preventive healthcare, better nutrition, and overall well-being. Furthermore, we collaborated with local stakeholders, community leaders, and healthcare providers to ensure that our proposed interventions are practical, culturally appropriate, and beneficial to farmers. By combining a community-centered, evidence-based, and collaborative approach, this study aims to contribute to sustainable improvements in farmers' health and quality of life.
The survey results indicate that 46.67% of the respondents are between the ages of 46 to 60 years old, followed by 33.33% in the 31 to 45 years old group. Meanwhile, 20% of the respondents are between 61 years old and above, and there are 0% of respondents aged 18 to 30 years old. In terms of gender distribution, most respondents, 73.33%, are male, while only 26.67% are female. Regarding educational attainment, a significant portion, 66.67%, have completed college, while 26.67% have attained an elementary level education, and only 6.66% have completed high school. No respondents reported having no formal education. For household size, the most common household size is 4 members, 46.67%, followed by households with 5 members, 20%. Additionally, 13.33% of the respondents live in household with 2 members. Another 13.33% of the respondents live in a household with 3 members, and only 6.67% of the respondents live in a household with 6 members. No respondents reported living alone.
In terms of diet, the majority, 93.33%, rated their diet as healthy, while only 6.67% respondents consider it fair. None rated their diet as very healthy or poor, suggesting that most individuals believe they maintain balanced diet. Regarding tobacco use, 20% of the respondents reported smoking or using tobacco products, while the majority, 80%, did not. Alcohol consumption habits varied, with 60% of the respondents drinking occasionally, 26.67% of the respondents never consuming alcohol, and 13.33% of the respondents drinking regularly. No one reported consuming alcohol frequently. When it comes to stress and anxiety, none of the respondents reported feeling stress, always or often. However, 80% of the respondents indicated feeling stress sometimes, while 20% of the respondents said they experience stress rarely. This suggested that distress is common but not overwhelming issue for most respondents. In terms of farming experience, 40% of the respondents have been engaged in farming for 5 to 10 years. 33.33% of the respondents have been farming for over 20 years. 2% of the respondents have 11 to 20 years of experience, and only 6.67% of the respondents have been farming for less than 5 years. What type of farming do you practice? Most respondents, 86.67%, practice both crop and livestock farming, while only 13.33% of the respondents engage in crop farming alone, and none focus solely on livestock farming. Daily working hours on the farm also varied, with 40% of the respondents working 4 to 6 hours, 33.33% of the respondents working 7 to 10 hours, and 26.67% of the respondents working less than 4 hours. No respondents reported working more than 10 hours daily. The biggest farming challenges faced by respondents include climate change and unpredictable weather, 23.44%, lack of access for farming tools and equipment, 20.31%, high cost of farm inputs such as fertilizers and seeds, 20.31%, and low market prices for farm products, 20.31%. Additionally, 15.63% of the respondents mentioned limited access to financial support or loans as a key challenge. The findings suggest the financial constraints, climate-related difficulties, and market instability are the primary concerns affecting the farming community.
In describing their overall health, most of the respondents, 93.33%, rated their overall health as good, while 6.67% of the respondents answered fair. None of the respondents rated their health as excellent or poor. In terms of healthcare visits, 86.67% of the respondents reported visiting healthcare facility occasionally, while only 6.67% of the respondents reported visiting regularly and rarely. No one selected never. Regarding chronic conditions, 6.67% of the respondents reported having hypertension, while 20% of the respondents indicated they had no chronic conditions. Only 6.67% of the respondents reported having diabetes and asthma or respiratory issues and none reported heart disease. When it comes to assessing healthcare services when needed, 60% of the respondents answered sometimes, 33.33% of the respondents answered always, and only 6.67% of the respondents answered rarely, while no one answered never. In terms of having access to healthcare insurance, 60% of the respondents reported having access to healthcare insurance, while 40% of the respondents indicated they did not.
Now, let's move on to Section D, Food and Security. Our data shows that 93.33% of respondents eat 3 or more meals per day, while 6.67% eat only 2 meals daily. This indicates that most farmers maintain a regular eating pattern. In terms of food sources, all respondents obtain their food from both farm production and the market, showing that they rely on both their own harvest and purchase goods. However, when asked about access to nutritious food, 60% of respondents said they sometimes experience difficulty, 33.33% reported no or never, while 6.67% answered yes or always, indicating ongoing challenges in accessing nutritious meals. These findings highlight the importance of improving food security through better nutrition programs, support for local farmers, and access to affordable, healthy food options.
Section E, Community Health and Environment. The survey results on community cleanliness indicates that the majority of respondents, 93.33%, rated their community's cleanliness as good. This suggests that most residents perceive their surroundings as well maintained and hygienic. A small percentage, 6.67%, rated it as excellent, indicating that only a few believe the cleanliness level is outstanding. Do you have access to the following resources in your community? The survey results highlight the level of accessibility to essential resources within the community. The highest percentage, 22.39% of respondents reported having access to clean drinking water, indicating that safe water sources are available to a majority of residents. Public transportation follows closely at 20.89%, suggesting that commuting options are relatively accessible. Healthcare facilities were identified by 19.40% of respondents, reflecting moderate access to medical services. Safe and adequate housing was acknowledged by 16.42% of the respondents, which may suggest that some residents experience housing challenges. Meanwhile, educational institutions were reported accessible by 14.39% of respondents, showing that access to schools may still need improvement. The lowest percentage, 5.97%, was for recreational areas such as parks and playgrounds, indicating a lack of leisure spaces for community members. What do you think are the most common health problems in your community? The most prevalent health concerns identified were respiratory issues, 33.33%, and infectious diseases such as flu and dengue, 33.33%. Drug or alcohol abuse was reported by 25% of respondents, while malnutrition and mental health issues were less commonly mentioned, 4.17% each. These findings suggest a need for stronger healthcare initiatives targeting respiratory health, disease prevention, and substance abuse rehabilitation programs. Are there any sufficient health programs or campaigns in your community? The results reveal that 46.67% of the respondents believe that health programs exist and are sufficient, while 53.33% are uncertain about their adequacy. Notably, no respondents explicitly stated that there are no health programs or campaigns. What challenges do you think prevent people in your community from being healthy? The pie chart illustrates the various challenges that prevent people in the community from maintaining good health. Based on the data, the most significant barriers include the high cost of healthcare, 47.62%, and lack of health awareness, 38.10%. These two factors suggest that many individuals struggle to access medical services due to financial constraints and insufficient knowledge about maintaining a healthy lifestyle. Other challenges identified include lack of health facilities, 4.76%, poor sanitation, 4.76%, and lack of transportation, 4.76%. While these factors may have lower percentages, they still play a role in limiting healthcare access, especially in remote or underserved areas.
Section F. Factors affecting farmers. What kind of support do you receive from the government or agricultural programs? The data in the pie chart illustrate the different types of support receiving from the government or agricultural programs. The majority, 32.60% of the respondents received financial assistance or loans, suggesting the finding remains a priority for farmers and agricultural workers. Farming tools and equipment and subsidized seeds and fertilizers are also significant at 23.92%, indicating that material resources are crucial for productivity. Additionally, agricultural training and seminars account for 19.56%, showing that educational and technical knowledge are also provided. Notably, no respondents reported a complete lack of support, which indicates that at least some government or agricultural initiatives are reaching the intended beneficiaries. The chart illustrates the effects of climate change and weather conditions on farming activities, showing that all respondents experience significant impacts. The most common issue reported by 42.85% of farmers is the increase in pest and disease infestations. Additionally, 34.28% of farmers face decreased crop yields, likely due to extreme weather events such as droughts, floods, and temperature fluctuations that disrupt plant growth. Meanwhile, 22.86% reported the loss of livestock, which may result from heat stress, inadequate water supply, and reduced feed availability. Notably, no respondents indicated that climate change had no significant effect, underscoring its widespread impact on agricultural. What improvements would you like to see in farming support on your community's well-being? The chart highlights key improvements needed in farming and community well-being. The top priority, 25%, is better healthcare services, followed by improved farming equipment and technology, 23.21%, financially support, 21.42%, and climate change adaptation programs, 19.64%, are also crucial. Lastly, 10.72% seek better farm-to-market routes.
The survey results provide insights into the demographics, health behaviors, challenges, and support systems of the farming community. The majority of respondents are middle aged males with a college education living in households of 4 members. Most consider their diet healthy with low tobacco use but moderate alcohol consumption. Stress is a common experience, though not overwhelming. Farming experience varies with many engaged for over 5 years, practicing both crop and livestock farming. Major challenges include climate change, lack of farming tools, high input costs, and low market prices. Health and well-being findings reveal that most respondents rate their health as good but struggles with chronic conditions like hypertension. Healthcare access is moderate with some facing difficulties due to financial constraints. Food security is relatively stable though some experience challenges in accessing nutritious food. The community is perceived as clean but access to resources like healthcare, safe housing, and recreational areas remains limited. Respiratory illness and infectious diseases are the most prevalent health concerns. Government support is primarily financial assistance, farming tools, and training programs. Climate change is significantly impacts farming, causes increased pest infestations, decreased crop yields, and livestock losses. Desired improvements include better healthcare services, farming equipment, financial aid, and climate change adaptation programs. This finding emphasizes the need for economic, environmental, and infrastructural support to enhance farming and community well-being.
To conclude, our study highlights the key challenges and needs of farmers in Barangay Nambaran. While most farmers have stable household and a good level of education, some still struggle with access to nutritious food and healthcare. Hypertension and other health concerns are common, but financial constraints limit their ability to seek medical attention. Farming remains their primary livelihood, yet they face major obstacles such as climate change, high production costs, and limited financial support. Though government aid exists, it is not enough to fully support their needs. The community has access to clean water and healthcare, but gaps in recreational facilities, education, and health awareness remain. Many are unaware of existing health programs, limiting their ability to seek proper medical care. To improve their well-being, we need better healthcare services, stronger financial and technical support, climate change solutions, and improved farm-to-market roads. Addressing these concerns will lead to a healthier and more sustainable farming community.
Number 1, enhance healthcare access and awareness. Implement more affordable healthcare services and conduct health awareness programs focusing on common health issues like hypertension, respiratory diseases, and substance abuse. Number 2, increase financial and technical support for farmers. expand government assistance programs by providing more financial aid, access to farming tools, subsidized seeds, and training on modern farming techniques. Number 3, develop climate change adaptation programs. Introduce initiatives to help farmers manage the effects of climate change, such as pest control measures, sustainable farming practices, and weather resistant crops. Number 4, improve community infrastructure. Enhance farm to market roads and transportation to make it easier for farmers to sell their produce and access essential services. Number 5, promote educational and recreational facilities. Increase access to schools and create more recreational areas to support education, health, and overall community development. Last but not the least, strengthen public health campaigns. Raise awareness about existing health programs and services to ensure that more people can benefit from available community initiatives.